Hey guys, it's the month of May and it is EDS Awareness Month, and today I really want to shine on 3 specific areas that we definitely need to address as clinicians to make sure that those with hypermobility and EDS are getting the right treatment. So today I'm going to talk about what are the top 3 things that are often untreated in patients with hypermobility and EDS. The first one is pelvic floor dysfunction. Now, immediately people think women, whether it's related to prolapse, pain, incontinence, but on the other side, it does happen in men. It can present with orthopedic pain, reduced performance athletically. It can happen with inability to completely void. There's a lot of things on both avenues that actually create more problems within the body, especially when it comes to hypermobility. With not being able to stabilize certain areas correctly, it can cause additional stress on other parts of the body. Number 2 is going to be the vestibular system or inner ear. There's a lot of complaints of motion sickness. There's recurrent injuries, and these things are very specific to that system because it's essentially what gives you your spatial awareness and understands how are you moving in space. And number 3 is gastrointestinal dysfunction, so GI dysfunction. Now, as PTs, we're not necessarily trained in school how do you address the abdomen when it comes to GI dysfunction, whether it's gastroparesis, constipation, acid reflux. When we look anatomically what's happening in the abdomen, it can be responsible for so many different things and so many of the secondary diagnoses that are associated with EDS, such as POTS and chronic fatigue, that if we don't address the abdomen or the GI system, it can affect those other secondary diagnoses. In addition, it can also affect orthopedic problems related to back pain, SI pain. So understanding how important the GI system is and also learning how to treat it is extremely important when it comes to treating those with EDS and hypermobility. So if we were to summarize everything with those 3 specific areas of pelvic floor dysfunction, vestibular dysfunction, and GI dysfunction, we understand that is our foundation to get the results that we need, not only from an orthopedic standpoint, but from an autonomic standpoint. So if you're watching this and you're looking for physical therapists with different sort of specialties or different types of training, I'd recommend someone who specializes in at least 2 of these 3 systems as a way to get you over the hump and get you back on your way to recovery.